Hello, everyone. Welcome to our meeting today, Cultivating Answers and Harvesting Solutions. Thank you all for joining us. And today, our key speaker will be Marlene Castillo from a Mexican. Thank you for joining. To start us off, we have the agenda. First, we have the National Farm Worker Awareness Week. Second is the NC Agricultural Conference mission and purpose. For the third thing, we have introductions. Then we continue on to panelist discussion, questions and replies. And then we go to the roundtable discussion, questions and replies. And then we finish off with questions and concerns. And as most of you guys know, or even if you don't know, this week is National Farm Worker Awareness Week, and it runs through the 25th through the 31st. What is National Farm Worker Awareness Week?
Ibrahim,
National Farm Worker Awareness Week. Wait,
sorry, can you scroll to the next slide, please?
Yeah. Sorry.
Right.
Okay, so for the NC Agriculture Conference review, the mission to improve the welfare of farmers, farm workers, farm labor contractors, and their respective families by providing educational and health-related support to benefit all throughout North Carolina. And the purpose, the goal is to improve the health equity of migrant farm workers across North Carolina. And for the objective is to identify and discuss challenges within the farm worker community and cultivate new opportunities with local and statewide organizations. The keynote speaker for this conference was Yasmin Garcia Rico. Our panelists were Lee Wicker.
Sorry, Ibrahim, I meant the presentation, not the slide. I do apologize. We're still on the welcome slide.
Oh, you wanted to go all the way back to the welcome. Oh, okay. I'm sorry.
I'm sorry, Ibrahim.
No. I thought you meant continue on with the presentation.
You're fine. If you could just move to the next slide. It's still stuck on the welcome.
Oh, I'm sorry. I have it on pause. I didn't realize. That's my fault.
It's okay.
Okay, there we go. So the agenda. Here's the agenda. Sorry about that all, everyone. So continuing National Farm Worker Awareness Week. Then we have NC Agriculture Conference Mission and Purpose, introductions, panelist discussion, question and replies, roundtable discussion, question and replies, and questions and concerns. Okay, now we're continuing on. This week is National Farm Workers Awareness Week. What is National Farm Workers Awareness Week? Is a week of action for communities and individuals to bring attention to farm workers and honor them for their contributions they make to our daily lives. And why do we celebrate National Farm Worker Awareness Week? Farm workers feed the world. 85% of our fresh fruits and vegetables are handpicked. There are an estimated 2.5 to 3 million men and women and children who work in the fields in the United States. Farms are in every state, including yours, yet some farm workers remain largely invisible and continue to live and work in horrific conditions.
Thank you,
And
Ibrahim.
then continuing on to this.
Thank you. So before we do get started, I do want to introduce myself. So good morning, everyone. My name is Marlene Castillo. I am the Community Development Director at a Mexican. It is a pleasure to have you guys here with us this morning. So today we did want to go over the most recent conference we had for the agricultural workers. But before I do get started, I do want to pass it over to Juvencio to get us started, and then we will go into the review and the findings that we were able to collect from this meeting.
Muy buenos días. Good morning, everybody. Thank you, Marlene and Gibran. As we presenting today to you the outcomes of the conference that we host in February of this year. But we also want to emphasize the importance of the participation of the community on this week. Here in Amezcan, we recognize the importance of migrant farm workers and agriculture industry. And it's why one of the reasons we are doing this type of work, but also we encourage our partners in our community to be engaged with this situation of farm workers. As we know, the number one industry in the state of North Carolina is agriculture. Now, when it comes about addressing the needs of migrant farm workers and also recognizing the contribution of farmers to the economy of the state of North Carolina is always invisible. So we hope that this information that we're going to share with you, it kind of gives you highlights into what it really looks like on the grounds. When we host this conference, we did it very intentional to bring different stakeholders into the table and creating some discussions addressing the issues around health, education, advocacy, and some others. We had a great number of individuals participating from different sectors. They spent a whole day convening and talk about the well-being of farm workers and farmers. And as we celebrate this week and recognize this sector, I will encourage you to also do the same thing in your own communities and your own spaces. We need to lift the voices of farmers and farm workers in the state of North Carolina, and we do need to recognize that they are a big part of our everyday lives. Without farm workers and agriculture, we're gonna have food on the table. So with that, thank you for attending this meeting today and allow us to present to you the outcomes of this conference that happens in February. Thank you, Marlene, and thank you, Gibran.
Thank you, Vencio. And so, Ibrahim, if you could move to the next slide, please.
Yep.
So the purpose of this conference we held back in February of 2024 was to improve the health equity of migrant farm workers across North Carolina. The main objective was to identify and discuss challenges within the farm worker community and cultivate new opportunities with local and statewide organizations. Our keynote speaker was Yasmin Garcia Rico. She is a director of Latinx and Hispanic Policy and Strategy for the North Carolina Department of Health and Human Services. And she did share valuable information that was shared on the newsletter. Not the news, yeah, the NC Farm Worker Resource Network email, which included this information. And she shared a little bit of the background of farm workers in North Carolina with the Department of Health and Human Services. Our panelists consisted of the NC Growers Association with Mr. Lee Wicker, East Coast Migrant Head Start Project with Mayra Rangel, the Farm Worker Health and Safety Educator, Roberto Rosales from the North Carolina Cooperative Extension, Carlos Valle Maranieras, the Pitt County Community College High School Equivalency Program Coordinator and Migrant Education Program, Stephanie Corona from NC Field, which stands for North Carolina Focus on Increasing Education, Leadership, and Dignity. And then lastly, we had Marco Partida from LILA Latinx LGBTQ plus initiative. So during the conference, we had a panelist discussion, and these were the questions and the responses that we got from our panelists. So the first question was, what innovative approaches can be implemented to address the challenges faced by agricultural workers in the agricultural industry? The key findings from this question were that working together to support the farmers and farm workers, focusing on the LGBTQ community, emphasizing that people in this community tend to isolate themselves working in these conditions, mobile health clinics to be more accessible to the farm workers, emphasizing the importance of working together, such as increased collaboration with other organizations. But the keynote from this response was having more communication with the agencies, the farm workers, and the farmers. Conducting community assessments. What are the community's needs and what are the challenges that they're being faced day to day? And then having state and federal level regulations changed. The next question was, do you feel that farm workers have sufficient access to new technological advancements or programs available to them? And our panelists responded that a majority of the farm workers have smartphones, so they do have a basic knowledge of how to use and communicate with their families. Smartphones are readily available, but their digital skills are limited. So utilizing online resources is a little bit difficult for the farm workers to be able to access. So although they can make calls and communicate with their families, having to search for a document or look up on Google is a little bit more difficult for them to do. More people have access to technology, but internet connectivity is an issue in most communities due to the rural locations. So what we found was that most of the times these camps were located in between the fields. So not many telephone lines or poles were located around their camp, so their signal wasn't as strong as it could be to be able to provide them with fast, reliable internet connectivity. Partnering with different communities to develop companies to tackle the issue of digital inequities for the rural areas. And then lastly, online school needs to be more accessible to receive an education if desired. The third question was, what measures can be implemented to ensure farm workers' health is prioritized while maintaining the productivity and sustainability of the agricultural community? So our panelists responded with collaboration of agencies and organizations to encourage farm workers to be proactive in their healthcare choices and needs. So having more community health fairs for these farm workers, going to them rather than going from them coming to us. Equitability, I apologize, taking into consideration the schedules and needs of both, making sure both are informed and are shared. So both for the farm worker, the farmer, and the contratista, and the agencies that are providing resources. Mental health services that are culturally appropriate and have Spanish speakers to be more understanding and trusting. So not automatically will these farm workers be open to mental health services or any type of service like that. So for the agencies to understand that it is going to take time to get their trust. But thankfully, most of the farm workers who are migrant, they do come back seasonally, so that trust can be built. It just takes a little bit of time and not quitting on the farm workers and being consistent with them. And lastly, mobile units that are accommodating to the farm worker schedules and locations. The next slide, please. The fourth question was, how can mechanisms be established to ensure farm workers are provided a secure and reliable platform so that they can express their concerns or problems with it without being susceptible to fraudulent activities or exploitation? Our panelists answered with education and exposure to governmental agencies, ensuring that they are comfortable with their agent. So most of the time that these farm workers are connected with an agent that they can reach out to if they have any issues or feel like they're being exploited. So establishing that trust from the start when they do come. Second was hosting ESL classes for the farm workers. The happiest and most productive farms are from when communication needs are met. And finding a middle ground where both parties, so the farm workers can express their needs, having a good communication between the what I just mentioned. Identifying methods to be able to address each other's concerns. And lastly, the desire to learn. Farmers must want to learn and the workers must also want to learn on how to communicate. Next, we had, how can we create an integrated mechanism approach for both parties to be able to thrive in the agricultural industry? The first one was to prioritize training and education for all the stakeholders. And that includes the farmers, the farm worker families, the contratistas, the agencies, and the farmers. Sorry. Participating in local events to help to learn from each other and build relationships. So for the farmers or the contratistas to take out the farm workers and learn more about the county that they're in, because most of the time they are stuck or not, like they're at the farm camps majority of the time if they're not working, other than on Sundays when they do get to go out to grocery shop or do laundry. Foster trust and connections between organizations and individuals, maintain consistency in community efforts and relationships, providing professional development opportunities for the farm workers. So addressing specific needs such as health concerns through tailored programs, utilizing community health workers to educate and empower farm worker communities. The next set of questions were the questions we asked the participants that came out to the conference. So we'll go into the first one. So the first question we asked everyone was, what are the primary obstacles that can prevent farm workers from accessing healthcare and education, and how can we collectively address them? So based off the 4 roundtables that we had, the 3 main points were that lack of accessible information channels for health care and education, conducting outreach initiatives to provide information and improve access. Language barriers posed a significant challenge. So enhancing cultural competency in healthcare services, conducting outreach initiatives with multilingual resources. So one of the points that was brought up here was that not every translation is the correct translation because there's just so many translations for Spanish. So ensuring that there is multilingual resources. And lastly, recognition and acknowledgement of farm worker needs are insufficient. So addressing transportation challenges with alternative options, exploring affordable or subsidized insurance coverage, and building trust and support for legal processes, collaborating with other agencies to address work hours and fatigue. The second question was, how can we foster a more inclusive environment within the agricultural sector for diverse populations, including migrant and seasonal workers? So the 4 key points for this one, based off the responses from our participants, was to provide tips and tools for inclusivity for all diverse populations, educating others about diversity using visuals and words, facilitating direct communication channels with the workers, ensuring workers know their rights and can seek help without fear, arranging sessions for direct information and support, advocating for increased state supervision for adequate care, and lastly, providing language and system learning resources. We can go. Okay, so the next one was, in what ways can we strengthen the partnership between local farmers and farm workers to ensure both economic and social benefits? We did have a lot of key points for this one. So the first one was fostering trust between farm workers and farmers through transparent communication and mutual respect, conducting joint training sessions where the farm workers and the farmers collaborate to address specific topics and issues they may be facing, visiting farm worker camps to gain insight into their culture. So fostering a deeper understanding and connection of what their life is day to day, providing banking resources for farmers to mitigate concerns about wage losses and secure funding, ensuring representation across different sectors within the agricultural industry to amplify the diverse voices, offering trainings for farmers to enhance leadership skills and effectively manage their farms. So offering trainings for the farmers to enhance their, same thing, sorry. Maintaining an open door policy and establishing a third-party entity for communication to ensure safety and respect for all the parties involved. So this would be possibly having the state agencies come in and ensuring that they feel safe and they have a sense of respect for both the farmer and the farm worker. And then lastly, educating farmers about cultural awareness through trainings or workshops, facilitating richer connections and relationships. The next was, how can nonprofit organizations, public agencies, and farmers better advocate for the rights and working conditions for the farm workers? The first one was lobbying for farm worker laws to improve their rights and working conditions. Telling the stories of farm workers to educate voters about the reason certain laws are needed. Donation drives such as essential supplies, food items, clothing items, personal hygiene items. So improving their housing overall and improve housing laws for farm workers. Advocating through education by providing knowledge about the policies and laws that they are empowering them and advocating for them as well. The education needs to be consistent through the farmer and the workers, ensuring everyone is on the same page and has the same information about their rights, and given out a Know Your Rights booklet. So as they come or as they join the farmer with the information about their rights. So that would give them a map of the clinics in the area, who to call if they need help, and what is correct and what is not correct for their rights. The next question was, what strategies and best practices can we implement to recognize and combat labor trafficking and exploitation within the agricultural industry? The four main points that we received were to educate about labor trafficking and exploitation, addressing issues about illegal work visas and corruptions, working with local authorities and improve data collection, so enhancing cooperation with district attorneys, providing orientation upon arrival, so offering a resource directory to access help from agencies, organizations that they can provide. And lastly, ensuring workers feel safe, and if they complain or report to any supervisors, they won't be afraid to do that. So protection from whistleblowers and facilitating reporting to legal aid departments. So that was the last question. We did want to thank everyone for joining us that day. This is a picture we were able to capture at the end. So Hibram, if you can pass to the next slide. So this was a list of the agencies that were able to come out that day. So we had the NC Growers Association, we had the Consulado General de, de Mexico in Raleigh, Pitt Community College, Lilia, Culiacan, the NC Department of Commerce, NC Counts Coalition, Pitt County Health Department, the NC Voters Project, Telamon TRC, Lenore County Health Department, Circles of Love, NC Department of Health and Human Services, ECU OB, NCDA, NCS, Catholic Charities, East Carolina University College of Nursing, Kinston Community College Health Center, Duplin County Health Center, not Health Center, Health Department, North Carolina State University, East Coast Migrant Head Start Project, NC Cooperative Extension, NC Field, Land Loss Prevention Project, the NC Agro-Medicine Institute, El Centro Hispano, Toxic Free NC, Access East, the North Carolina Department of Commerce, MTW District Health Department, Blue Cross Blue Shield NC, NC Stop Human Trafficking, Trillium Health Resources, the Food Bank of Central and Eastern North Carolina, Legal Aid NC, the NC Immigration Law and Justice Center, Southern Coalition for Social Justice, Upper Coastal Plain Council of Governments, and the NCCHCA, and lastly, the Pitt County Cooperative Extension that was gracious enough to host us that day. So the next slide, please. So now we'll open it up for any questions or concerns. This PowerPoint is also available for everyone to view. If you did not get a copy from the previous email we sent, please be sure to submit that in the chat box so we can share it with you. So we'll open it up and I will pass it back to you, Juvencio. I'm not sure if Juvencio, sorry.
Yeah, I'm here. Thank you, Marlene. Thank you for this great information. And as Marlene stated, we now open it for questions. So any comments that you want to contribute to this conversation?
Are you able to hear me, Juvencio?
Yes, go ahead, Jasmine.
Yes, hello?
Adelante.
Okay. Yeah, so for those of you who don't know me, my name is Josie Garcia. I'm the health educator at Kinston Community Health Center. I work in the outreach department. And so I guess one of the comments I'd like to make, Juvencio, I don't know if this is in the works with Amexcan, but I think it was discussed during the conference. Maybe have some kind of like meeting or reunion with some of the local um, farm worker labor contractors, just because some of the seasonal workers or seasonal families that I have seen so far are coming with a farm worker contractor or they work for a contractor. And so I think kind of giving them that awareness as well, not so much the families, but to the contractors, I think that would help being able to build a relationship or a foundation with organization and farm worker contractors. Um, just because whether they're like afraid of being threatened or if they're too ignorant per se as far as wanting to know how us as organizations can help them as well. I think it'd be like a good idea to host or even come up with something like that. Like it doesn't have to be you know 10, 15 contractors, but maybe if Mexcan or any other organization that's on this call right now or meeting knows of any contractors that are willing to at least speak from their perspective as far as how they work with their workers and as well as the grower, I think that'd be a good idea.
Thank you, Josmary, for that recommendation. But I think what you propose on the table is some call to actions in terms about how we can reach out to the contractors and begin a conversation. This is one of the things to do here on this framework. So we are going to begin having conversations with the corporate extensions and the people is in charge of those contractors that they also have, because they do have to receive some type of training through the agencies to really get into the fields. So we're going to begin having those conversations with those individuals and see maybe for the next conference, because this is going to be an annual conference, maybe for 2025, we can be intentional and bring some contractors into the conference. I mean, Scan has a relation with two contractors. One is in Wilson, which has over 200 workers. The relation has been developed for the last 3 years. So every year we work very close with that particular contractor, and we go out to the camp. They do have 3 camps, and has been very open. He reached out to us for help before the pandemic, and we've been working with them for since then. So every year, right now we are getting ready to make a site visit to the camps and provide some assistance to the workers and also whatever he also needs. But he has a huge number of people coming to work in North Carolina and in Florida. Anybody else has any questions or any recommendations as we build in this framework?
I have a few questions. Well, and I'll introduce myself. My name is Carlos Lorenzana. I'm a manager of partner relations with NC Medicines. We're a statewide nonprofit pharmacy. So when it comes to the access to healthcare, I'm assuming most don't qualify for any type of health insurance, correct?
Yes, you're right.
Okay, right. So one of the things that we are recently doing, and I definitely understand the part of the translation. So what we do normally is we try to keep our documents at a elementary school level reading, both in English and Spanish. Try to keep them very simple, not too overloaded. But what we are trying to do right now is develop a new income verification form. So to come into our free pharmacy program, which is our prescription side of things, so we give out free prescription medicine to those who qualify. Um, you have to be uninsured, living in North Carolina, and income be at or below 300% of the federal poverty level. So what we're trying to do is develop a new income verification. So we have a zero income statement for people that don't work, but we're trying to make a new one specifically for farm workers. We know sometimes, and someone correct me if I'm wrong, it's hard to try to get some sort of proof of income. So without that, we can't, because of our grants and other things, if we don't have some sort of proof of income or no income, then we can't enroll them into our free pharmacy program. So that's one of our things, and we actually haven't rolled it out yet, but we were just working on it this past week. What are we calling it? It's income verification form for farm workers. I think that's what we're calling it. But that's one of the things that we are trying to do as a statewide agency. Now, the other thing that we have trouble with, it's actually doing that outreach. So I'm located in Charlotte, actually. Our pharmacy is in Charlotte, but we mail our prescriptions. I know on the slide, on one of the slideshows where you had everyone who attended the conference, I saw NC Field, Access East, and Duplin County Health Department. Those are some of our partners, actually. So they are aware about us. They know our application process, and we work alongside with all of them. But what we're also trying to do is basically do a mass enrollment. So enroll as many people as we can into our free pharmacy program. And of course, we would love to connect with the mobile clinics or any of the clinics in those areas, because we can provide the medicines, but we're going to need someone to write that prescription. So that's another barrier, I guess, that we're finding ourselves in. If they're not within one of our partners that have doctors or that have providers that can write the prescription, if they're on medicines, then we won't be able to help them. So I'm up for suggestions or ideas as far as it goes with that.
I guess my question will be to you, Carlos, is those partnerships that you already have with some of those agencies that you mentioned, how successful has been since you've been partnered with them?
So we have several patients with them. I think I'm not sure what, so the number has decreased somewhat with accessees because of Medicaid expansion, but we know there's still a great number that we could be helping, and especially the farm workers. Same thing with NC Fuel. I don't think our numbers have gone down, but they have stayed steadily. So it has worked, and we have a lot of patients. And of course, that's our main goal would be try to help more people get access to prescription medicine if they need it. So, you know, if they come and they're here for a year or 8 months, but they're not taking their medicines, then that could probably lead to a lot of problems, uncompensated healthcare costs and things like that. So we are trying to help, as you know, pretty much everybody. If they can't work, then the farmer's gonna have issues, and they're gonna have health issues, and then they're gonna end up in the hospital. But we are trying to grow in partnership or with other agencies to reach out to those communities.
So, Carlos, so you would be interested to take your mobile union to some of these migrant camps? And here we got Kingston Community Health Center. Joe will be interested also to partners and go out to those migrant camps and just kind of showcase the services that you offer.
Yeah, that is one of the things we recently talked about as well. Even if it's one, two, or however many events, and our main goal would be to educate on our free pharmacy program and enroll them while we're there. But I guess the other thing I would mention for the farm worker income verification form, it will have to come through one of our partners. So we're probably are going to need either more partners or some of the partners that we do already have to tag along with us, which, you know, that can be a conversation or whatever.
I had just put over there my mobile number, which is my WhatsApp number. If you
Okay.
can send a text message, and we can also deep into this conversation. And
Sure.
just Smart, you had raised your hand.
Yes, Valencia. So I was just gonna let Carlos know that I sent him a direct message with my email on it. Just because I'm the one right now doing the farm worker outreach.
Okay.
So if you want to, you know, like get in contact with me, we can potentially set something up because this may be something that the outreach department can utilize. But I did have a question for you, Carlos. So
Yeah.
there are numerous times where farm workers are coming with existing medication,
Right.
and they may have, you know, like a, I guess like a, you know, like a handful of medication for maybe 3 months, 4 months, or maybe even less. So I guess my question to you is, for those particular farm workers that arrive with medication already, could they potentially get a refill without having to technically come to, you know, let's just say to, you know, like come to go see a doctor? Does that make sense?
Yeah, it makes sense. So that was basically one of the problems that I was describing. The issue we would have is if they're, I'm assuming that we're talking about they're coming with a prescription from outside the state. So that would be the main thing. So we can't accept prescriptions written outside of the United States, which is again one of our concerns. So they would probably qualify based on everything else. But if we don't have a provider that can write that refill prescription or that prescription that's licensed here in the United States, yeah, we wouldn't be able to do that. And it has come up. We are trying to find ways, and I think the fastest and easiest way would be to try to work with someone that has a provider that's willing to do that, whether that's volunteer based and FQHC or whichever it might be, that would probably be our best bet.
Yeah, like I'll follow up with you. I wrote your email down, but if you want
Sure.
to send me a email with some more information, I'll definitely let my team know and see if it'll be a good fit for Kinston community.
Yeah, perfect. Thank you.
Well, thank you, Josmar, and thank you, Carlos. So you got my mobile number there, so you want to send me a text message. Happy to talk to you.
Thank you.
Anybody else has any comment or question? So if it's not, so Marlena, do we have anything else, announcements or anything about this week that we celebrated? Or Hebron, anything else that we want to mention about the farm worker community?
Yeah, so we have a couple sites for our farm worker donation drive. These sites are in Duplin County, Craven County, Pitt County, Lenore County, Wilson County, Sampson County, and Nash County as well. We are collecting long sleeve shirts as well as hygiene items. to collect for the farm workers and give out to them. And yeah, if you guys could help spread the word, that would be really appreciated. Thank you so much for that.
Gibran or Marlene, can you put the information on the box, the
Yeah,
flyer,
I can
so
put that
people can have
information in
that?
there.
And I will encourage you guys to help us out and reach out and outreach for this campaign. We've been doing this for many years, and this year has been kind of slow, so we really need your help to let some agencies. I know people like to do yard sales and things like that, get rid of some of the long sleeve clothing. So the farm work can really benefit, and they really appreciate when we go out to those camps and we are give away those hygiene items and also the clothing that they need. Remember, a lot of these farm workers, they don't bring nothing with themselves when they come. The ones that they can contract through the different farmers, and we also have farm workers that come from other states. So I will encourage you to either participate in this campaign. Anything else, Marlene?
No, I think that's it, Vencio.
Well, thank you so much. Let's continue to collaborate together and provide some better assistance and services to the farm worker community. Thank you for your participation this morning, and we look forward to see you soon. And we have that information there, so the different locations where you can encourage your partners or your agency to donate for this campaign. So have a happy holiday, and we see you sometime. Take care. Bye-bye.